Can you see my screen?
Yes.
Yes, your screen is visible to us.
Okay. Thank you. Assalamu alaikum. Thank you for this opportunity. That was a very nice introduction. So I will not elaborate on that. So my topic is women substance use and pathways to prevention and recovery. So as you know, in my country, I work as a demand reduction expert, trying to bring together people to holistically address substance use. So if you look at most of the countries, most of the Southeast Asian countries, we are very reactive towards substance use. When something happens, we try to address that instead of proactively trying to prevent substance use. So if you look at international data and if you look at the World Drug Report, we can see that the gender gap in substance use is narrowing rapidly, particularly for opiates and psychotherapeutic drugs. Can you can you hear me clearly?
Yes, sir, you are audible. Yes, sir.
Okay. So one of the things that we need to understand in the aspect of substance use disorders in women is that they go through something called telescoping. So women actually tend to progress more rapidly from starting to use and to dependence than men. They go through something scientifically called telescoping, where they become, they develop substance use disorder very fast, much faster than women. And also when you look at withdrawals, you see that their withdrawals are more intense than withdrawals suffered by men. And also one other aspect is craving. So when you look at substance use from a treatment lens, we should understand when we are planning treatment for women, we should understand that they have more intense cravings than men. The cravings, the need to use drugs that arises emotionally, psychosocially is much more intense than men. And when you look at telescoping, we can see that when you look at it from early intervention lens, we see that the window for early intervention is significantly smaller and shorter than for men. And also we have now all over the world, even in the Maldives, we are seeing polysubstance use becoming an issue. Usually when we talk about substance use, we see people who are using opiates, people who are using stimulants like meth. But now we see that a lot of people who are suffering from substance use actually use a lot of substances together. That again creates implications and difficulty in providing treatment.
प्रेजेंटेशन कैसी थी अच्छे थे कहाँ पे
Is there any questions up to now that any questions from the participants?
No, sir, no, sir.
So I will try to speak a little bit on in Urdu also. I know a little bit of Urdu, not much. I can manage. A lot of Maldivians, they have grown up on a steady diet of Amitabh Bachchan films. So we know a little bit of हम सबको थोड़ा सा उर्दू मालूम है. So I will try my best to do justice in Urdu. So there are biological and psychological risk factors when you look at women in general. So one is hormonal influence. So we can see that there's a fluctuation in estrogen and progesterone during the menstrual cycle that can actually heighten craving and vulnerability to relapse. Now, again, this is something that we need to look at when we are providing support to women who are suffering from substance use disorder. Menopause and hormonal transitions are actually critical periods of risk for increased alcohol and medication misuse. Now, there is also metabolic differences when you look at the biopsycho risk factors. Women metabolize alcohol and drugs differently due to lower body water and enzymatic activities. This actually leads to higher blood concentration and faster organ damage, like liver disease. So a lot of research is very much based on what men go through with substance use disorder. Very less research is there. We actually need much more research on what what women go through in substance use disorder, and specifically in the Asian context, because we are very different. Our family environment, our supportive environments are very different from the Western societies. So we need to keep that in mind and do our best to do research that reflects our needs. And also, when you look at pain sensitivity, women report higher prevalence of chronic pain, leading to higher prescription rates of opiate use disorder. So when you look at opiates, which is predominantly used in Southeast Asia, I think Pakistan also has a huge issue with opiate use. All over Asia, it's maybe in the Maldives, it's the second most used drug in the Maldives now. We have very high prevalence of cannabis use. Second is opiate. So when you look at opiate, the relationship with opiate and pain is significant. So that is again something that we need to look into when we are providing treatment for women who use substances. And trauma is also another important factor that we need to integrate into our care when you look at women who use substances. So we can see that according to international and UNODC data, we can see the high prevalence of abuse. 30 to 59% of women in substance use treatment meet the criteria of PTSD, post-traumatic stress disorder. So this is again something that we have to be very, very aware of when we are providing services to women who use substances. It should include trauma-informed care. So when you look at the mechanisms for use, for many women, substance use is ritualized, compulsive comfort-seeking behavior to manage dysregulation from trauma. So, and women are more likely than men to self-medicate for internalizing disorders like depression and anxiety. And when you look at the causes, if we treat substance use in women, and if we only address the substance use factor of a person, of a woman who is using substances, we tend to forget the whole person, like trauma, mental health, and all that. And also there is re-victimization. Active use often exposes women to further violence, creating a cycle of trauma and substance dependence. Now, when you look at the Maldives, one of the things that we have found out with treatment for women is that after we provide treatment for women, when we let them go into the community, they again go to the same households, the same environment where they were abused. And again, the cycle begins. So I think it's very important to look into this and provide halfway houses, sober houses for women to effectively reintegrate into the community, rather than sending them directly into the environments that they have felt the abuse in. So there is stigma also associated with help seeking, the bad mother stigma, societal in Southeast Asia. There's a lot of societal judgment that creates shame, preventing women from seeking help. You are a mother. How could you do this and all that without understanding the complexity of substance use, fear of loss, the fear of losing child custody is one of the single most significant barrier to treatment for women all over the world. And a lot of our policies and strategies are very punitive. Although a lot of trained people,
पहले भी मैंने अपलोड की थी बट वहाँ पे
I can hear somebody's mic. It's if the organizers can switch off them. Yes. Thank you. So in a preventative strategy, so one of the things that I think आप लोग अभी पढ़ रहे हैं यूनिवर्सिटी में, आप लोग बाहर आकर एडवोकेट करें ये प्रिवेंशन को बढ़ाने के लिए. हमारे देशों में प्रिवेंशन का अहमियत नहीं होता. बहुत सारे हमारे साउथ ईस्ट एशियन देशों में हम बहुत रिएक्टिव है. जब when something goes wrong, we react to that, and that creates policies and strategies that are reactive. हमको देखना चाहिए कि ये क्यों हो रहा है, और उस क्यों को हम अगर एड्रेस करें तो हमारा ट्रीटमेंट और प्रिजन सिस्टम में लोग जो the amount of people we get into prisons and into treatment will significantly drop. And ये मैं मेरे सरकार को भी एडवोकेट कर रहा हूँ कि हमारा फोकस प्रिवेंशन में ज्यादा रहे. So if you look at the UN, currently there has been 2 declarations that the UN has been working on. One is the Ovidio Declaration, which calls for strengthening prevention in all the member states, and the other one is called the Eindhoven Declaration, which calls to safeguard children from substance use. So the Ovidio Declaration calls that every government should spend 1/3 of their drug control finances towards prevention. So now, if prevention should be developmentally focused and age appropriate. So, for example, prevention for girls must also address body image, self-esteem, relationship. We shouldn't only focus on refusal skills. A lot of programs, they focus only on refusal, just saying no. That doesn't work anymore. It doesn't work anymore. We have to be very comprehensive. Now, there's this intervention course, the girls circle model. This is an evidence-based structure which supports groups for girls 9 to 18. And key components of this integrate relationship theory to build resilience and connection. And this has shown that it has proven to reduce delinquency, substance use, self-harm by fostering safe and authentic connections. Now, this self-harm, this is something that is very much prevalent in the Maldives. We are a 100% Muslim country. So we have issues to comprehensively address drug use. We have issues with the religious community also. बहुत सारे लोग ऐसे बिलीव करते हैं कि जब हम ड्रग्स के बात करें तो लोग ज्यादा ड्रग्स लेंगे. Lekin there is no research saying that if we give age appropriate information to people, to young people, they will use drugs. It's the complete opposite. रिसर्च ये दिखाती है कि जब हम रिस्पॉन्सिबली ड्रग्स की बातें हमारे बच्चों से करें एज अप्रोप्रिएटली, वो बच्चे ड्रग्स के बजाय हेल्थी चॉइसेस मेक करना शुरू कर देती है. So this is also something that we need to address. Age appropriate information on what is happening with substance use and universal screening. There is this model called SIBRIT, screening, brief intervention and referral to treatment. This is done in primary care in a lot of countries. We are also advocating for this in our primary care. So if a girl or if a child comes a lot to primary care with accidents or with injuries, the doctors will do this SIBRIT and find out whether the person, the girl or the child has chances of going into substance use. And with this screening, we can actually refer the person to services before substance use develops. So this can be done in the obstetrics, gynecology setting or primary care. And this is easily available on the internet. There are trainings also available that you can do to become an expert in doing SIBRIT. Now let's look at treatment considerations. And theoretically, we should address women in addiction as a disease of disconnection. So when you look at treatment and recovery depends on re-establishing connections with self and others. So research science tells us that substance use disorder harms the bio, psycho, social and spiritual aspects of a person. So ऐसा है कि spiritual जब हम कहे वो religious नजरिया से हम लोगों का सोच ऐसा आता है. Whenever we say spiritual, we think of religion, but it's much wider than that. Religion is part of being spiritual, but हमारा जो इस्लाम भी है वो भी कहता है कि हम सब रूहानी है. हमारी रूहानियत है. हमारे जो लोगों को दिखाई देता है वो एक ड्रेस है. हमारा नफ्स ही सब कुछ है. सो ये स्पिरिचुअल कनेक्शन बहुत इंपॉर्टेंट होता है जो so the connection between me and myself, the connection between me and my family, the connection between me and my society, that is also spiritual. क्योंकि स्पिरिट का कनेक्शन होना बहुत जरूरी है. सो रिलेशनल कल्चरल थेरेपी ये कहता है कि we should focus on building growth, fostering relationships. Therapy helps women deconstruct abusive relationships, relational images, and practice mutual empathy and authenticity. Now, क्योंकि हमारे देश की बात करूंगा, we don't have many people who are trained in addiction. So we have very less capacity of trained people to address substance use. इसीलिए हमने भी देखा है कि ग्रुप थेरेपी बहुत इफेक्टिव है to reduce isolation and enhance connections. Trauma specific treatment services. Now, हमारा भाई कुछ ऐसा ट्रीटमेंट मॉडल्स हम फॉलो करते हैं उससे रिट्रॉमेटाइज होने का चांसेस बहुत ज्यादा है. जैसे कि earlier TCs where we do encounter, we do haircuts and all that, very confrontational approach to treatment. ऐसा ट्रीटमेंट्स रिट्रॉमेटाइज करने की चांसेस बढ़ाती है. So we must avoid services that actually re-traumatize, and we should understand the impact of violence. So मेरे देश में Maldives में जो ट्रीटमेंट मॉडल है वो भी सरकार का, हमारा ट्रीटमेंट सिर्फ सरकार देता है. In Maldives, treatment services is only provided by the government. So it is a very stagnant therapeutic community kind of treatment where people are re-traumatized. So मैं सरकार के together we are trying to change the treatment interventions into something much more effective. Trauma specific interventions. Now, if you so one thing that I would suggest for the people who are studying to be in treatment is to look at the Covington spiral of recovery. That's a model. This model reviews recovery as a spiral of healing rather than a linear line. A lot of times we believe that recovery is linear, it's a straight line. It's not. It comes with ups and downs. So when you look at substance use disorder, if you look at the definition itself, it's a chronic relapsing brain disease with the compulsion to use despite harmful consequences. So relapse or definition का part है. तो ये it's very important for us to accept the fact that relapse is also part of the process of recovery from substance use. So there are very good curriculums that we can actually contextualize to हमारे communities को contextualize करने के लिए बहुत सारा existing curricula है, जैसे कि helping women recover, beyond trauma. These curriculums address the intersection of addiction, trauma, and sexuality. And treatment environment should be physically and psychologically safe for women. जैसे कि women only group, giving focus on women's issues separately rather than doing it together with men. And integrated care models. जैसा ये इंटीग्रेटेड केयर मॉडल्स में सब कुछ इंटीग्रेटेड होता है ट्रीटमेंट के साथ, जैसे कि प्रेग्नेंट एंड पोस्टमार्टम वुमेन मॉडल इंटीग्रेट सब्सटेंस यूज ट्रीटमेंट विद प्रीनेटल एंड पीडियाट्रिक केयर, क्योंकि so it will be easier for women who are pregnant. So कुछ key components है residential और outpatient services where mothers and children stay together. मेरा एक दोस्त यूएस में ऐसा मॉडल यूज करता है गर्ल्स को फीमेल ट्रीटमेंट के लिए, कि वहां जब आउटपेशेंट के लिए ट्रीटमेंट के लिए आए तो बच्चे को लेकर आने की एनवायरनमेंट है, जो जब मदर ट्रीटमेंट सीख करने के लिए आउटपेशेंट जाती है तो चाइल्ड केयर का component भी उस ट्रीटमेंट में is integrated into the treatment. Now, parenting education, child care, mental health support. So ऐसे integrated treatment care का impact भी ज्यादा है. Integrated programs improve birth outcomes, higher birth weight, increase treatment retention and support family preservation. तो अगर हम पॉलिसी लैंडस्केप का बात करें तो हमारा बहुत सारा पॉलिसी बहुत प्यूनिटिव है, इसीलिए स्टिग्मा है, इसीलिए इट्स वेरी डिफिकल्ट फॉर वीमेन टू सीक केयर because of the punitive approach. When we have something like the TC confrontational approach, people would not repeatedly go to treatment because बाहर आके वो जो बात करेगा वो कहेगा यहाँ तो बहुत स्ट्रिक्ट है, ये हो रहा है, वो हो रहा है. सो इसीलिए we should advocate for supportive policies and strategies, जैसे कि protecting women from persecution if they disclose use or enter treatment. तो मेरा ये रिकमेंडेशन ये है कि हमारा पॉलिसी शिफ्ट होना चाहिए from criminalization